Every emergency starts with a victim. Whether the cause is an accident with major injuries requiring fast and accurate treatment, a major incident such as a hospital evacuation with hundreds of patients to keep track of, or a natural disaster such as a flood requiring mass evacuations to rest centres. Attending professionals and organisations have the same needs: response, track and trace. Emergency Data Interchange System, EDIS. The Cruciform Emergency Documentation System was originally developed by CWC Services for major disasters in the UK. Regarded in the UK as the gold standard for triage, the system has been refined for over 25 years and used across a range of real-life emergency scenarios worldwide. In addition to triage, the system has been further developed for hospital evacuations and public evacuations to local authority rest centres. We were the first to introduce barcodes on triage tags in 1995, making the numbering of victims both faster and more accurate. We now use GS1 barcodes, the international standard system. Now we've developed an electronic system to dramatically improve emergency patient information flow still further. EDIS. The system comprises a mobile app backed by a server and administration components. The EDIS app enables a smartphone to read the GS1 barcodes, enter critical patient data, take photos to attach to the file, and send it via any available data network to a server where it can be made immediately available to healthcare or other authorised professionals. Throughout an emergency, the patient comes into contact with attending professionals, say a doctor or ambulance paramedic. Not only do they have access to data already entered, but they can immediately add or change personal or medical information as it becomes available. As a result, medical teams at the destination hospital can be fully prepared for the victim's arrival. Later, when the patient is undergoing treatment, the hospital will need to provide a variety of answers to calls, from a distressed wife, for example, his children, a concerned employer, or professionals who may come into contact with the patient, all needing information and reassurance on the patient's location and condition. Instant access to the appropriate level of information will reassure family and friends and save the hospital time. Paramedics, police and other professionals will need another level of information access. Further access to information held will be available to designated professionals, for example the doctor treating the patient when he arrives at hospital. EDIS starts when the staff first snap the barcode on a patient's cruciform with their mobile device. The system opens a unique file that follows the patient through the emergency. More data can be added ad hoc as it becomes available. Captured data is time and geostamped to provide an audit trail. The audit is useful for later analysis, but also, for example, to locate a patient's whereabouts at a particular time. The ability to add photographs to the file also allows a visual reference to the patient's identity and condition over the course of the emergency. Photographs are stored cumulatively in the system and once again time and geostamped. The unique features of EDIS are also suited to a variety of other scenarios, such as a planned or emergency hospital evacuation, or mass public evacuation in the event of a flood or other large-scale disaster. In this scenario, it is the Cruciform Patient Evacuation System, CPES, that provides a fast and effective identifier for the patient, accompanying them during evacuation to any of a number of locations. We've already seen how effective EDIS can be in tracking patients to the hospital. Now the same technology will track them as they are evacuated from and between hospitals. When the patient's barcode is scanned at any location, the time and location will be available throughout, together with updated medical information, allowing the hospital staff to instantly track and trace their patients. It also allows staff with legal responsibility for patients to quickly locate them and be advised about their state. Similarly, in a national disaster such as coastal flooding, for example, EDIS can be used to record and track evacuees to a number of pre-planned holding facilities such as rest centres. Because a scenario of this nature can involve a large number of people, the ability to rapidly identify where evacuees are, when they arrived, and their condition throughout is vital. Often in these situations, members of the same family may end up in a number of locations, causing distress and worry. EDIS can provide the facility to link evacuees very rapidly. Because EDIS records time and location, a very effective audit trail is automatically produced from the very first moment the evacuee enters the system, and which can follow that evacuee throughout their time at rest centres or other facilities. This audit trail can be vital for record keeping, legal use in any future court case, or for management learning and planning purposes. The EDIS app works as fast as a barcode reader and provides a powerful and versatile tool for hospitals, police, and other rescuers, as well as local and national government. Backed by our rigorous manual systems, we think EDIS could be a game changer for emergency management. Emergency Data Interchange System, EDIS. Email edis@cwc-services.com or visit our website. Find out more by calling 01353 968 982.